In today's episode, I'm going to take you through a very simple pelvic mobility drill which can work wonders for low back pain. So, lying down on the floor, I'm going to be moving my pelvis primarily, okay? So we want the knees in line with the hips, legs bent, feet flat on the floor, pointing forward. I'm going to put my fingertips on the anterior iliac spines to get some feedback for what's moving. Now, very, very simply, I'm going to roll and tip my pelvis into anterior tilt, and it is a roll. And as I do that, I'm rolling down towards the tip of my tailbone. Now, you'll notice that if your spine is moving well, that'll pull your chin down. So your cervical spine will move into a little bit of flexion in the upper cervicals. And then I'm going to roll and tuck my pelvis into a posterior tilt. And if your spine is moving well, that will likely lift your chin. And as you move gently between those two positions with as much ease as possible and staying away from any pain that you may have, you're going to be mobilizing that pelvis, the joints immediately below the lumbar spine. So I'd ask you to do that for 5 repetitions, nice and slowly like this. If you don't have the movement coming into the neck, feel free to add that in yourself at the end of each position and emphasize it a little bit. We can also tilt the pelvis laterally. To do that, I'm going to actually let you use your femurs. So we're going to roll down into anterior tilt. I'm going to drop my legs gently to the side until I feel my pelvis tip over to the left. That's knees left. I'm then going to pull into posterior tilt, recenter my legs. Roll down into anterior tilt. Gently tip my legs till I feel my pelvis tip in that direction. Posterior tilt, recenter my legs. Other way, anterior, tip, posterior, reset. Anterior, tip, posterior, and reset.